When, when you asked me to come here, well, I got those three questions, and I really didn't know what to do to answer them. So me, being a medical doctor, I decided to try to convert myself into a political journalist as Shoma, and I looked at the World Health Statistics that every year the World Health Organization publishes. And there I saw the data of how health is in the West, in the countries of the West, and how health is in India. And I really decided India has nothing to offer us as a matter of health, or as health is related. But then I really realized that health is a very complex concept. I want to define health the same way I won't define pornography, but I know that health is related to some data, and some data are a very important part of whatever health is, but also values. Health is not related only to data. Health is related to values. And look, the World Health Organization tells us clearly that there are some social determinants of health: a healthy physical environment, fair employment, decent work, social protection across the lifespan, access to health care, and some other factors like distribution of power, money, equity in health programs, gender equity, political empowerment. The same thing. In 1956, there was the Ottawa Conference, and 32 states belonging at that moment to the World Health Organization said that for there to be health, there had to be peace, shelter, education, food, income, stable ecosystems, sustainable resources, social justice, and equity. We all know that the community's health is related to these four factors: biological features, physical and social environment, individual and collective behavior, and the healthcare system. And at least the three last of them, at least the three, and maybe in a variable proportion, maybe the first one too, are socially determined, and they represent the equity or inequity of opportunities, and they are the manifestation of power relationships. We also know that individual health is related, of course, to the individual's biology, to the family we live in, to the community, to the geography, to the climate, to the culture, to the belief systems, to the public policies, to the market, to the state, to the system of production and consumption of goods, and that the ecosystem puts limits to it also. If we want to make it even more clearer or easier to understand what health is, we come here and we see that health here, down here, is related, of course, to household economy. There are all these factors. Even globalization up there is directly related to the health of a community. And knowing that, accepting that, and giving that for good, what does India offer? What's the situation of India? Okay, India, 1,270 million people. It is the second most populous country in the world after China at this moment. And 1 out of 6 people in the planet live in India. It is expected to have 1,500 million people in 2030. India is a complex amalgam of 28 states with very different health situations. There are the 9 high-focus, this is the Indian government who says it, 9 high-focus states that hold 48% of the population, and they have the 62% of total Indian maternal deaths, 70% of total infant deaths, while there are these southern states like Kerala, Tamil Nadu, Karnataka, Andhra Pradesh, who hold the 22% of the population, and they have less than 12% of maternal deaths. And child mortality also is very different in some places in India and others. So, what else? Well, more than 50% of the population in India is below 25, and over 65 is below 35. That means it is a very young country with a terrible problem with child slavery. And there has been this child and adolescent labor abolition bill, and this is related to health. This is directly related to health. It is the largest illiterate population in the world, 25%. That's what I read recently. There have been changes in law too, changes in criminal law in relationship to the, around the rape cases. Someone talked about this afternoon, the Verma law. There is the surrogacy offer. Surrogacy, which many people in the rich countries think is perfect, is why not? I've never met a rich woman that would put her uterus for a poor woman. Kidneys, kidney trafficking. This is also related to health. India is one of the countries that give organs to the rest of the world. It is true that in some places, in Tamil Nadu, that's a very interesting article in the British Medical Journal that came out in last April, I think. Well, it seems things are changing over there. I'm happy to say patients or patients. I think the Novartis trial related to the Gleevec was very important and was very recognized worldwide. Another data that Shoma mentioned, somehow expenditure in health in India is at 2.4% of the gross national product. That sounds very little, isn't it? Yeah, it is. Especially if we compare to the gross, to the expenditure in healthcare in the United States, which is the 15.7%, but in the Health Olympics 2011, that's a way of comparing the different situations of the health of the population in the world. United States, who spends 15% of the gross domestic product, is the 34th country in this Health Olympics. This is a classification that they do in Vancouver University for the United Nations. Okay, we think we know that I don't like to talk about religiosity, I don't like to talk about spirituality, because I'm not very sure either what those things are. But I like to talk about meaning systems. And meaning systems are the collection of beliefs and of motives and of goals in the life of a person. And it seems, I think we could say that these meaning systems influence somehow in a very distant way and also in a very proximal way how healthy we live. I mean, if we have a meaning in life, if we have social support, if we have gratitude, hope, optimism, we might have a much better health than if we don't have it, or in a very much more proximal way, if our religion or if our whatever, if our beliefs tell us that drinking alcohol is bad, well, you might live longer, much more sadly, but anyway, you might live longer. If they tell us, and I do tell you, that smoking is bad for your health, you might live longer and a better life, and so on. So all of these meaning systems influence somehow the health of the population. This is a very interesting article that Amartya Sen wrote, published several years ago, in 2002. And he compared the life expectancy among males. I don't know if that works. No, that's not working anymore. Okay, the life expectancy among males and females in India, in Kerala, compared to the United States. And you see that life expectancy in Kerala and in the United States is very similar, much higher than all India and much higher than in BR. And he compared that to the self-related morbidity. And it's very funny, because the people who live longer in India are the people in Kerala. They say they are much sicker than the rest of the population in India, and of course much sicker than the population in BR, and very similar to the population sick. Sick. Sick, sorry. Much more sick, yeah. And similar, they relate a similar morbidity than the people in the United States. Of course, there have been some studies afterwards that say this isn't true, and but that's what happens with scientific studies, you know. All the scientific articles end up saying more studies are needed. Thanks to God. Ipsos is a corporation that does studies the self-reported happiness, and this was published last year, Yes, 2012, and they did this interview to 19,000 adults in 24 countries. 70% of them said they were happy, 22% were very happy. I don't understand how, I mean, that's unbelievable. And in India, that's, I don't know if this is believable or not, but 43% of the people that were interviewed they said very happy, and there was a rise of 5 points in relation to the last interview done. So we might say, because if you see, Italy is down there, Russia is down there, Japan, France, Germany are much farther down than India and Indonesia. So we might say that the happiest are not the richest. But again, there is this article just published this May in which the richer you are, the happier you are. Okay, India, we talked about yoga. There are so many ways of doing yoga and so many different types of yoga. I mean, you can start there and, you know, it's like a self-service yoga. Okay, we have India, transcendental meditation with the Beatles, and now David Lynch is one of the biggest promoters of transcendental meditation. And let me tell you, there are more and more studies saying how both yoga and how transcendental meditation can function in a person's body. There have been lots of studies, like does yoga and gender fitness in older adults, contextualizing the effects of yoga therapy on diabetes management, and so on and so on and so on. There are a whole lot of articles talking about that, and the conclusion is that there is no scientific evidence that no yoga, no transcendental meditation do any good to your health. But how can there scientific evidence be when we're talking about values? Science has nothing to do with values. Or let me tell it in a different way. Science and values are very related, but science will never prove that some values are more valuable than others, at least ethically. What can India offer us, offer the West? Values. I think India can offer very, very important values on self-introspection, on self-acceptance, on inner knowledge, and so on and so on. This is true. And I wanted to say it so. But I think the West can offer India some other values, like the value of justice and the value of solidarity through a potent healthcare system, which we should fight to maintain. And my last thing, your body is a battleground, says Barbara Kruger, and it is true. All these fights take place in our battleground, which is our body. But as Michel Foucault said, our body is not only a battleground, our body is also a weapon. It's an instrument to fight against whatever they want to do with our bodies. Eskerrik asko, that means thank you very much in Basque, which is my mother language. Thank you.